Dental implants. I want to kind of go over the different types of dental implants. So the first kind of dental implant that you'll see is just single tooth, right? So, hey, I've got one bad tooth and doc says, hey, we need to take that tooth out, and they may either bone graft it, and the treatment plan for that is kind of like, okay, we'll take the tooth out, we're either going to bone graft and wait, and then go in and put the implant in, or you can get what's called an immediate implant, which is where if the jawbone's available and we can get the implant into a favorable position, we can take the tooth out and put an implant in the same day. That's gonna kind of cut down on the treatment time. It's also gonna save some of the gum tissue. You know, a really challenging thing in the world of single tooth dentistry, right, is like making sure, especially in the front teeth, those are always the hardest, is like making sure that the gums line up with the teeth next to it. You know, I'm sure everybody has seen somebody that's like smiled and they got one tooth that's significantly taller than the next. And that can be a significant challenge in the world of dental implant, you know, single tooth dental implants. And so that's why immediates can be favorable. So if your doc is kind of treatment planning an immediate implant, you know, and they have confidence in their ability, it's not a bad thing to do. But, you know, the implant, you can see it's shaped like a tooth root. You know, it's essentially just a little screw, right? We place a screw in the jaw. We put it, you know, we won't put a tooth on that immediately. Because of the way that dental implants heal, it's kind of like a broken bone, right? You break your bone, they're gonna put you in a cast. You need that to be stable. You know, you don't want any movement over the time of healing. So if we were to put a tooth immediately on a single tooth implant, right, those forces, you know, when you bite, not only do you have up and down forces, but you have some side to side forces. That will cause little micro movements in the implant and reduce its stability, and that will affect the healing, and it may cause it to fail. So that's the reason why, you know, you'll hear places like, oh, teeth in a day, or, you know, and then you'll go in, oh, I've got to get a single tooth. You realize like this can take a lot longer than this style of treatment, and it's just due to these implants are all attached together by a set of teeth, so that kind of prevents their movement. This one being a single tooth, that tooth will still move and that implant can move. So we've got to let that implant heal in the bone before we can put a tooth on it. The other style is a dental implant bridge. So this would be something that gets treatment planned. I mean, most people know what like a dental bridge is, right? Where you got two teeth, they prep them like crowns, and then that, you know, these three teeth would go on natural teeth. Well, the other option, and this kind of goes back to that partial denture that we were talking about too. This can even take the place of that partial denture. You can put a couple dental implants in there, and then you would just put 3, 4, 5 teeth on those 2 to 3 dental implants, and that would act as a bridge. And that's just gonna kind of replace a section of teeth that are missing in your mouth, right? And so same thing though, these have to go in, they have to heal for 4 months, and then we come back, retake impressions, and then replace that section of teeth that go on there. Both of these are wonderful options. Like if you're only missing one tooth, you're missing a couple, and the other teeth are really healthy, these are really wonderful options, because as a doc, I don't have to prep another tooth, so I don't have to take a burr, you know, and remove any tooth material to put a bridge on it. So it kind of saves your natural teeth. This also acts more like a natural tooth. You know, you're not having to worry about that space that's there. You're not having to sacrifice another tooth in order to get that one tooth back. So it's a great treatment plan for people that are only missing, you know, a couple teeth here, maybe one tooth, maybe a little section of tooth here. Now to kind of get into what we do here at Nuvia. And this is what we have treated thousands and thousands of patients, and this is called all on X. You might hear it, all on X, all on 4, teeth in a day, next day teeth, next day smile. I mean, there's hundreds of ways to talk about this prosthetic and the name of it. And the reason is we call it all on X or all on 4 is we need, you know, 4 to 6 dental implants, and we place those in the jaw in very specific spots. And then we put a brand new set of a full arch. So generally it's first molar to first molar, 10 teeth, 12 teeth. And that would take the place of somebody that if you needed to have all of your teeth removed, this is a great option for that. You know, it's similar to the denture, but this is fixed. So meaning that it doesn't move. So, and in a lot of cases when those implants go in, those teeth can go on either the same day or the very next day. We here at Nuvia, we deliver a permanent solution the very next day for ours. And then that just means that you have fixed teeth, nothing's moving, and you know, your chewing forces and your chewing function gets rehabilitated to 90 to 95% of what it was before you walked in through the door. All right, I kind of want to talk about some of the major pros of dental implant treatment. So dental implant treatment is more of a permanent solution. You know, as long as you're healthy, you know, you take good care of it, you do your hygiene, everything needs maintenance in life, right? Like these can really last a long time and hopefully for the rest of your life, depending on, you know, obviously it really depends on you taking care of it. They prevent bone loss. Like I talked about earlier in the video where the body really needs something to stimulate and tell it to keep the, you know, use the energy to keep that jawbone around. They will act kind of like a tooth root in an instance that the body will realize, okay, something's there, something's pushing force on that. I need to continue to keep this bone around because it's being used to support a structure. It does restore full function. So, you know, in terms of the denture, we talked about 30% chewing force, right? A full arch of dental teeth, or even, you know, a bridge, you're getting back into that 95, 98, 99% function. You know, you really would have to really struggle to find somebody that says they can't chew what they want to chew with a set of dentures. And in a lot of cases, patients can actually chew harder with this set of teeth, and we have to kind of build that in when we make these, because with our natural teeth, like if you guys were to, you could feel a little human hair, you can feel a little piece of, you know, paper, right? That feeling does kind of go away with this. And then also if you were to like squeeze on your teeth real hard, say you're sitting in your chair watching this video and you just, you know, your body's saying like, hey, like stop. It's, you know, there's that pain response that's telling me like, hey, you don't need to squeeze this hard, right? Well, with full arch and dental implants, they don't have a nerve ending. So you kind of, they do lose that feeling, right? So patients can squeeze hard, they can chew hard. And so a lot of times we are retraining people like, hey, you don't have to chew as hard. You know, the food's already cooked. You know, you don't need to kill that cow too. You can, you know, the burger's already ready and cooked for you. You can, you know, you don't have to go after it. And then also, if you're healthy, you don't smoke, you don't have any other predisposed conditions, an implant's a 97% success rate. At Nuvia, we actually have ours a little more. So we're right now, over the years that we've, you know, collected our data, we're at 99% success rate, meaning that the implants we place are still in those patients today. All right, I kind of wanted to review a couple different timelines. You know, so I kind of review the timeline of, you know, if you were to visit a provider that's non-Nuvia provider, and then kind of go over in the next slide, you know, what would be your timeline if you were to come to a Nuvia office. And this is talking about full arch, all on 4, all on X. This isn't necessarily even talking about the single or the bridges anymore. Now we've kind of shifted our focus to those full sets of teeth on 4 to 6 dental implants. So as we call it, the traditional teeth in a day method. And so you're always going to go through your initial records appointment. And that's going to happen on surgery day, whether you visit a provider that's us or whether you visit one of our offices. You're going to go through there. We're going to get medical history. We're going to make sure you're safe. The patient safety is always priority. It should be a priority at every office you visit, right? We want to make sure you're healthy enough to undergo a procedure like this. But we're also at that point in time, like as a restorative doc, we're looking at where your teeth currently are. And we always ask the patient, like, do you like your teeth, right? Because some patients come to us and their teeth are in a pretty good spot. They're just in bad shape. And it's like, what do you like about your teeth? And some patients are like, look, I want to have a set of teeth just like I have right now. And then some people are like, hey, give me that Hollywood white smile, you know? And so that appointment is really your opportunity as a patient to let those docs know what your expectations are, what you want, what your dream smile looks like, right? And so that all happens kind of before surgery. We'll also take a ton of measurements. You get a bunch of x-rays and we'll, you know, because then the planning portion of it goes in. And then on surgery day, so that's when we come in, teeth will come out if you have teeth remaining. If you've been in a set of dentures, that's when we go in and we just kind of place the implants. And you know, the traditional manner that's been done for a long time, we'll either take a denture, which you may have your own, or one may be made for you, and we'll do what's called a conversion on that denture. And that's where we actually take that denture and we reshape it and attach it to the implants. And that kind of acts as your prosthetic during the healing phase. You're gonna wear, and then some other offices will print, they'll call it a printed PMMA, where it goes through a 3D printing process and they'll attach that. And so there's a number of different ways that that a teeth in a day can be temporized. Every office has a little different workflow. It just depends on what the docs are comfortable using. And if they're using a lab, what the lab is comfortable doing. During that time, you're gonna wear those temps for 4 to 10 months. And it's gonna do a number of things. We're gonna check how the implants are healing. make sure the speech is there, phonetics are there, make sure everything that you're happy with those teeth. The only, one of the kind of the downfalls is that a lot of times these temporary teeth, these acrylics, these printed, they're flexible materials. And so they can lead to some breakages over the time. I mean, it doesn't always happen, but it is something that can be a part of that process in getting a true temporary set of teeth. So they go through 4 to 10 months, and then when you're done with that 4 to 10 months and you've been wearing this temporary, you're gonna go through the process again to remake that final. So you're gonna go through a similar day of your records, taking the implant positions, understanding where the teeth are. We go through what's called another wax try-in, kind of like an denture appointment we were describing before, and making sure that those teeth are in the right position for you and you're happy with them, and also honing in on that, making sure your bite is stable. So I mean, in a traditional timeline where traditional teeth in a day, it can take anywhere between 4 to 6 to 12. I've had some of my own patients, when I did it before the way we came up with here at Nuvia, I had some of my own patients in 18 months still in temporaries as we were just trying to kind of hone the process in and get things to fit right. So it can take a little bit longer by going this route. It's not a bad route, but it can definitely take some time. All right, so we just talked about our traditional timeline. Now I kind of want to talk about what sets Nuvia apart and kind of go over we'll call it the Nuvia timeline. So we deliver a true permanent set of teeth in 24 hours. You will always go through that first records appointment. When you visit one of our offices, we're gonna do a consult, we're gonna do a restorative appointment in the same manner as you would go over here. And that's the same thing, is to go over your pricing, understand if you're really a candidate, because once again, not everybody needs to have all of their teeth removed. Like a lot of people have healthy teeth, just because it is a treatment option doesn't mean it's your only one. So it's worth your time to, also this is a great treatment option, but if you feel like, hey, I've got some healthy teeth, don't always understand that, hey, if somebody wants to take them all out, visit a couple of providers and, and have them give you a couple different opinions, right? But so in our process, you're gonna go through a restorative records appointment first. Same thing, meeting with your docs, understanding, what your expectations are, where do you want your teeth? What do you want your smile to look like, right? We take all of those records beforehand. That'll go to our lab. So that's a big difference too, is that like our labs, we also develop our own prosthetics. We're not working with, an outside lab. Then on your day of surgery, you'll come in, teeth will come out, implants will go in. Our restorative docs will do a records appointment after we wake you up from surgery. We'll do a number of different records. All of that will go to our lab overnight, and that's where my current team, as I said, I run the lab now. They work overnight and deliver you a true permanent set of teeth, and so you will get those delivered the very next day. We don't go through a temporary process. We developed a way to make sure that the teeth are in the right spot and they're going to function really, really well for you from the get-go. And so you don't have to worry about having a little softer material placed in your mouth or worried about those breakages over time. So our total time from your day of surgery to your permanent teeth is roughly about 24 hours. We still do see you for follow-ups. It's not like, hey, you come to a Nuvia office, 24 hours, you're good to go, we let you go, right? We still want to make sure that, hey, we see you, a couple weeks later, make sure your gums are healing great, make sure the implants are looking good, right? And then we want to see it, we also see you at 4 months, we want to make sure you understand how to clean it. Make sure, once again, those implants have healed really, really well, and you're happy with everything that we've done for you. So it's not this, hey, we see you 24 hours, and then you're done. Like we do want to establish that relationship and make sure that you're okay for that entire time. But in terms of what we do that's different, no temporaries. Get that final set of teeth and then you're back to living life. All right, I kind of wanted to talk about some of the costs of different dental implant treatment. So if you're looking at a single tooth, you're looking anywhere between, $3 to $5K. And as we said earlier in the video, mind you, these costs are not absolutes. Every office is going to have a little different fee, so we're just kind of giving you guys the ranges. Your All-on-X, the style that the treatment that we offer here at Nuvia, this is going to offer, this is going to vary case by case, and that includes providers, locations, even within our own centers, because whether you're a patient that just needs a top arch, you just need a bottom arch, if you need a more advanced surgery, the costs vary by those, right? And so to help you guys out, Nuvia has we've created our own cost and information guide. And if you're interested, you can just look in the link below. All right, so naturally one of the biggest questions and most frequent questions we get, right, is like, how much does this cost? We we can't tell you that over the internet, right? We can't give you a price because we've got to see your individual case. That's why we encourage people to come into a Nuvia office. Well, we're going to take some x-rays. That's going to be reviewed by a doc, and they're going to look at your specific situation. And we don't have any hidden fees. You know, everything is included in our cost that we give to you, but we want to make sure that your case is diagnosed correctly and that you're getting the treatment that you both need, you know, and deserve when you are visiting one of our offices. All right, so as we did previously in the video, I want to talk about some of the cons or challenges that, you know, can come about with dental implant treatment. You know, it can happen just the same as it does with dentures, right? So once again, I don't love the word cons because this is still an investment in your health, right? But these are some of the challenges that, you know, can be brought about by undergoing dental implant treatment. So the investment, it may be higher than most of the other options. You know, cheaper is a wrong word to use here, right? Because like a denture is still a great treatment option. If that's what if that's where you have to go and that's where, you know, your dental journey takes you, that can be a wonderful treatment option and you don't have to feel bad about having to make that choice. But this, you know, dental implants, it can be a little bit more expensive, right? The one thing everybody hates to talk about, implants can fail. You know, this is any medical procedure. You know, there can be complications with them. You know, even in the best of patients, my own patients, you know, I've, like I said, I don't even know how many thousands I've done at this point in time. I lost track at it, right? Like the healthiest people, sometimes implants fail. Most of the time, that's not a big deal. We take the implant out, we can put it in a new spot, we can graft things and let it heal, and then we can come back later and replace it. There are some cases where it can be challenging, but we will be honest with you. Like I always tell my patients, like if they came to me and a patient has waited years and years and years and they've had a ton of bone loss, and I only have one shot at this surgery, I'm gonna tell you that. Like I'm gonna sit down in the chair, I wanna be real with you because I want the patients to understand, like, not only is this a challenge for me and a challenge for them, like I want them to have the true honest opinion and the true honest potentials, right? It would be not truthful of me to not tell a patient like, hey, like we have one shot at this and this is, you know, and we got to make sure that you take care of it. I'm going to do the things to the best of my ability. But like, look, if an implant does fail, we may have to get back into a set of dentures. But we will tell you that, like you deserve that as a patient. We want to make sure that you're informed. But overall, you got to remember, implants in non-smokers, people who are healthy, we get 97% success rate, right? There are very few medical procedures out there that are 97% success rate. And at Nuvia, once again, ours is even higher than that. We're at 99. So if we tell you things that can work out and we feel like, and you're willing to partner with us, because remember, this is a partnership. It's kind of like buying a car. You can't just drive it off the lot and not put oil, not put tires, not take care of it, right? You still got to clean these. You still got to visit us for follow-ups. Like all of those things are the maintenance of this. It still requires maintenance, and that's all part of the treatment. And then when you do visit a provider that's a non-Nuvia provider, remember that you can be in a long treatment timeline. You can be 4, 6, 10, 12 months or even longer. That's kind of the benefit of coming to a Nuvia office, is that you can get that permanent set of teeth the very next day. And after our follow-ups, you're on your way and you're back to living life. All right, so I know I just talked about, hey, implants can fail. If you guys have any questions about that, we did actually make a video which you can check out right here.